Welcome back to my channel. If you're new here, my name is Neil Galve and I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students or nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you are already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos Mondays, Wednesdays, and Fridays. If that is something that you're interested, please make sure to subscribe now. Hit the notification bell so that you'll be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, you guys, let's jump into the video. Hi everyone! Kumusta kayo? Isang panibagong nursing discussion nga ang alay ko sa inyo for today. Today is Wednesday and this is your nursing pharmacology class discussion. Yes, another entry natin ito sa ating nursing pharmacology where I actually create drug studies of the some uncommon and less common medications that we can encounter in the area. And this time, this is all about Rituximab medication infusion. Now, kung hindi mo pa napapanood yung other nursing pharmacology drug study lecture materials I created under my channel, I'll be putting the actual playlist link on the description box or whenever the icon button pops out, check that one out because that's all for you. And also don't forget the other lecture materials I have on my channel. Recently nga nung Monday nag-upload ako about sa what's this? Possible NCLEX type of questions that you may come across ngayong darating na NCLEX exam. Panoorin mo yun because that's all for you. I have their rationalization and teach you how to attack and approach certain questions sa NCLEX, PNLE. Nako, napakarami na nga po. Gamitin mo yun because that is all for you. Now, gusto ko lang i-grab itong opportunity na to before further proceed to thank you who's listening right now, to thank you who's watching right now for making it possible and for making it here today for our today's online class discussion about Rituximab. 3 times a week nga po ako nag-upload ng mga lecture materials ko sa YouTube and yeah, I want to thank you for always showing up and coming here and being with me. Thank you so much. We're moving towards 20,000 subscribers. Oh my gosh. Oh my goodness. Let's just pause for a moment and let's just appreciate the fact that we're moving towards 20K. Napakarami na nga po talagang sumasanib dito sa ating sumasanib talaga. Nagjo-join at nakakataba naman ng puso sa mga suporta nyo. Keep on sharing my videos, keep on liking. Do not skip the ads every time that we have ads because those are helping those things that you're doing, the ads, the sharing of my contents, you're actually helping me promoting my channel and we need those ads to keep on doing and be better, creating better contents for all of you guys. So, maraming salamat po again sa pagsuporta nyo. Gusto ko lang kayong anyanyahan. Kung hindi ka pa nagsubscribe, mag-subscribe ka na. I have a Facebook page. It's Neil Galve. I also upload my contents there and I also have a podcast channel. It's 3 a.m. Conversation with Neil Galve. I talk about mental health, awareness, and creating a better life in this world. Ang saya, diba? It's 3 a.m. Conversation. Lahat po ng link ay nasa description box. Panoorin mo yon. Check out mo yon, mag-follow ka na, and don't forget to tag me every time you're sharing my contents online, okay? So mag-proceed na tayo. Once again, this is Rituximab infusion, one of the DMARD's anti-plastics, anti-CD20 monoclonal antibodies. So, we're gonna have a thorough nursing drug study on this medication, Rituximab. Kung hindi ka pa familiar sa medication na to, this is your chance to be familiar with this type of medication. Mag-proceed na tayo. Let me share to you the objectives for our today's discussion. I'm going to give you the classification, generic and brand name, route and dose of administration of Rituximab. And then we're gonna discuss about the mechanism of action, indications, contraindications, side effects, and of course, this will not be a nursing drug study. We're not gonna talk about the nursing responsibilities in administering Rituximab therapy or infusion to your patients. Handa ka na ba? Handa na. Let's begin. So first up, classification, generic and brand name, route and dose of administration ng iyong Rituximab. Brand name niya, ito na. Classification: DMARDs, other antiplastics, anti-CD20, monoclonal antibodies. Generic and brand name respectively ha. We talk about the generic, it is the Rituximab. Brand name, this is sell under the brand name Rituxican. Okay, Rituxican, that is the brand name. Rituximab, that is your generic name. In terms of route and dose of administration, naman nurses, listen. For the first infusion, initiate infusion at the rate of 50 milligram per hour. In the absence of infusion toxicity, increase infusion rate by 50 milligrams per hour, increments every 30 minutes to a maximum of 400 milligrams per hour. Yes, when you administer this type of medication for the first time and even in a subsequent time, this is like one of those medication that we increase the level of rate. Increment. This works on increment. Hindi lang siya naka-KVO, hindi lang siya to run for 4 hours. No. Every after 30 minutes of administering your Rituximab, you have to reassess your patients for any signs of intoxication, any adverse reaction. If no adverse reaction noted or any intoxication noted, you can increase the rate to what? You can increase the rate to 50 milligram per hour, or as ordered by your physician. All right? Now, for subsequent infusions naman, standard infusion, initiate infusion at the rate of 100 milligram per hour. In the absence of infusion toxicity, increase rate by 100 milligram per hour, increments at 30-minute intervals to a maximum of 400 milligrams per hour. And also, this is indicated by as ordered by your physician. Okay? So once again, I want you to take a screenshot of this and use this as your guide whenever you are going to start the infusion of your Rituximab infusion for your patient. Alright, malinaw ba yun? Malinaw. Mag-proceed na tayo. Mechanism of actions. Okay, nako, exciting. Eto na. Let's discuss how this Rituximab works in our body. Eto na tayo. Don't worry because I got you covered. Alright, so, eto na. Alright, so, Rituximab, the humanized chimeric anti-CD20 monoclonal antibody, represents a powerful tool for treating B-cell malignancy and is licensed for the treatment of relapse or chemo-refractory low-grade or follicular non-Hodgkin's lymphoma (NHL). It has a unique mode of action and can induce killing of CD20 plus cells via multiple mechanisms. The direct effects of Rituximab include complement-mediated cytotoxicity and antibody-dependent cell-mediated toxicity, cytotoxicity. The indirect effects include structural changes, apoptosis, and sensitization of cancer cells to chemotherapy. In vitro studies have made a significant contribution to the understanding of these mechanisms of action and have led to the development of innovative and effective treatment strategies to optimize patients' response. The most significant of these strategies is the combination of Rituximab and CHOP chemotherapy. Ano yung CHOP? Ito po yan. Abbreviations yan ha. CHOP stands for cyclophosphamide, doxorubicin, vincristine, and prednisone, which is proving a highly effective combination in the treatment of NHL, non-Hodgkin's lymphoma. All right. However, all patients do not respond equally well to Rituximab, and in vitro studies have identified a possible mechanism of resistance involving the anti-complement inhibitors CD55 or CD55 and CD59. Neutralizing antibodies to CD55 and CD59 can overcome resistance to Rituximab-mediated complement-mediated cytotoxicity in vitro. This study overviews our understanding of the mechanism of action of Rituximab and identifies how this knowledge could be applied in a clinical setting to maximize response in both sensitive and resistant patients. Once again, that is your mechanism of action. Ang lengthy, hindi ba? But I want you to just remember this when it comes to the mechanism of action. Direct effects of Rituximab include complement complement-mediated cytotoxicity and antibody-dependent cell-mediated cytotoxicity. And the direct effects include structural changes, apoptosis, and sensitization of cancer cells to chemotherapy. This is mainly what I want you to understand when it comes to mechanism of action. Alright, malinaw ba yun? Malinaw. Let's proceed. What is the indication of your rituximab? Rituximab, or what we call rituximab, the generic name, is indicated for the treatment of adults patients with the following. Eto na tayo. Relapse or refractory low-grade or follicular CD20 positive B-cell NHL non-Hodgkin's lymphoma as a single agent. Alright, previously untreated follicular CD20 positive B-cell NHL in combination with first-line chemotherapy and in patients achieving a complete or partial response to a rituximab product in combination with chemotherapy as a single-agent maintenance therapy. These are the indications, okay? Wag malilito. Next, what are the other indications? Non-progressing, including stable disease, low-grade CD20. Low-grade CD20 positive B-cell NHL as a single agent after first-line cyclophosphamide, vincristine, and prednisone CVB chemotherapy. What else? Lastly, we have your previously untreated diffuse large B-cell CD20 positive NHL in combination with cyclophosphamide, doxorubicin, vincristine, prednisone, yung CHOP, or other anthracycline-based chemotherapy regimens. Alright, so once again, these are the indications of your rituximab therapy. Next, we're gonna talk about contraindications, of course. Hindi natin to kailangang ma-miss. Kanino mo ba hindi ibibigay itong gamot na ito? Una sa lahat, eto na, hindi mo siya ibibigay sa mga pasyenteng may herpes simplex infection. This is also contraindicated to patients who have unusual viral infection called cytomegalovirus infection. Once again, that's cytomegalovirus infection. Next, an infection due to fungus. Pneumonia with fungus called pneumocystis girovesi. Alright, and bad infections, contraindicated din siya sa patients with high amount of phosphate in blood, low amount of calcium in blood, also high levels of potassium in the blood, anemia, decreased blood platelets, mga more or less blood disorders. Next, contraindicated din siya sa low levels of a type white blood cells called neutrophils. Pag mababa ang neutrophils ng pasyente mo, hindi mo siya ibibigay. Hence, the doctors are actually ordering baseline CBC before we start the rituximab infusion. Okay? So, ito na, angina, chest pain, a type of chest pain. Next, ventricular arrhythmias, a type of abnormal heart rhythm. Blockage of the stomach or intestine. Acute kidney failure, hindi mo siya pwedeng ibigay doon. Decreased kidney failure, mga AKI, mga CKD, SRD. Next, pregnancy. A patient who is producing milk and breastfeeding. Why? Because it didn't cross the placenta. Infection caused by varicella zoster virus. A rupture in the wall of stomach or intestine. Ang daming contraindication. Resolved hepatitis B. Next, reactivation of hepatitis B infection. A type of immune system problem called hypogammaglobulinemia. Let me say that one more time. Hypogammaglobulinemia. Alright? Next, hepatitis C. Progressive multifocal leukoencephalopathy, a type of brain infection. Basically, sa mga pasyenteng may active infection. Next, disease due to West Nile virus. And lastly, your parvovirus infection. Once again, napakadami nga pong contraindication sa mga ito. Kailangan mo itong i-rule out through your nursing assessment and nursing history taking together with your doctor and some laboratory test if your patient is actively experiencing these types of conditions, because you will be aware that and you will know that this is contraindicated to those patients. Alright? Mag-proceed na tayo. What are the side effects of administering rituximab? Along with its needed effects, a medicine may cause some unwanted effects. Although not all these side effects may occur, if they do occur, they may need medical attention. You have to notify your doctor, your primary care provider, if any of the following side effects occur. Mag-proceed na tayo. Ano ba yung mga side effects na sinasabi ko? Eto na siya. Una, low white and red blood cells. This could manifest as fever, chills, body aches, pale skin, unusual tiredness, and infections. Side effects niya, nausea and diarrhea. Swelling in your hands or feet, or in the hands of the patients or in their feet, extremities. Headache, weakness, painful urination. What else? Muscle spasm. Depressed mood. Yes, this could also alter some psychological effects on your patients because it can cause depressed mood or change in the mood. Next, cold symptoms such as stuffy nose, sneezing, sore throat. Once again, these are the side effects of of rituximab infusion. Mag-proceed na tayo, which is the most exciting part of this nursing and drug study, which is your nursing responsibilities. Ano-ano ba yung mga role and responsibility mo as a nurse for your patient who is having or receiving rituximab infusion? Eto na. Una sa lahat, makinig, mag-list down na kayo kung gusto nyo mag-list down dyan. Okay, mag-ready lang ako. Hinga-hinga, eto na. First up, monitor signs of allergic reactions including anaphylaxis and angioedema. Reactions include pulmonary symptoms, tightness in the throat and chest, wheezing, cough, dyspnea, and skin reactions such as rash, pruritus, urticaria, burning skin, swelling in the face. Be especially alert of these signs after drug infusion, o tinatawag nating infusion reactions. Notify the doctor or nursing staff immediately if these reactions occur. It's also important for you to educate your patients about these signs and symptoms so that they'll be alert and they can call you once any of these side effects or the symptoms occur during the infusion administration. Okay? Next, monitor and report signs of progressive multifocal leukoencephalopathy, including ano-ano ba yung mga signs and symptoms ng multifocal leukoencephalopathy: headache, confusion, seizures, and loss of vision. Early recognition and adjustment of drug dosage is important in resolving this syndrome. Okay? Malinaw ba yun? Malinaw. Next one, assess heart rate, ECG, and heart sounds, especially during exercise. Report any rhythm disturbances or symptoms of increased arrhythmias, including palpitations, chest discomfort, shortness of breath, SOB, fainting, and fatigue or weakness. Monitor neuromuscular signs of electrolyte. Ano ba? Electrolyte imbalances that might indicate tumor lysis syndrome. Signs include severe muscle weakness or paralysis due to increased plasma potassium, hyperkalemia. Hence, hindi siya binibigay. Naalala mo, contraindicated siya sa mga pasyenteng mataas ang potassium sa blood, or muscle hyper excitability and tetany due to phosphate and calcium imbalances, yung tinatawag nating hyperphosphatemia and hypocalcemia. You have to notify your doctor, treating physician, or any of your colleague to stop the infusion if these signs occur. All right? Malinaw ba yun? Hence, proper patient education is very important because they're the one who is going to verbalize. So, part ito ng education mo. Next, monitor and report skin or mucocutaneous reactions, including inflammation, swelling, and burning pain of the skin and mucous membrane. Lalong-lalo na saan? Sa peripheral site, sa IV site. Kasi this could cause to avoid phlebitis and also to prevent any harmful reaction to the skin and to the veins of your patient. Okay? Next. Monitor signs of bone marrow suppression, including neutropenia, fever, sore throat, signs of infection, thrombocytopenia, including bruising, nose bleeds, and bleeding gums. or unusual weakness and fatigue that might be due to anemia or other blood disorders. You have to notify the primary care provider if these signs occur. Siyempre, stop the infusion and then notify the doctor. Now, if treating rheumatoid arthritis periodically, assess patient's impairments. Ano yung mga i-assess mo? Pain, range of motion, functional ability, and disability to help determine if anti-rheumatic drug therapy is successful. Assess any increased joint or back pain to rule out musculoskeletal pathology. That is, try to determine if pain is drug-induced rather than caused by anatomic or biochemical problems. Lastly, nurses, it is part of your responsibility to assess blood pressure, BP, periodically. Report for any problem of decreased blood pressure, yung tinatawag nating hypotension. Okay? Diyan na nga natatapos ang ating nursing drug study for today. Thank you so much you guys for watching and listening. I hope you learned something. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know if you have other nursing topics that you want us to do. Comment it down below. Abangan nyo nga yung upload natin ngayong darating na Friday because it's going to be fun and going to be educational as always. And tulungan nyo na nga ako, ipamalitan nyo na sa Radyong Sirang pinakabago, pinaka-fresh at ang pinakalibreng nursing review center sa balat ng YouTube. Don't forget to follow me in all my other social media accounts. Everything is at Neil Galve except for my TikTok account, which is Neil Galve Official. I have a Facebook page. It's Neil Galve Official. I have, podcast channels, 3 a.m. Conversation with Neil Galve. Don't forget to subscribe and check it out. Once again, kung wala pa nagsasabi sa'yo for today, I love you, I'm proud of you, and thank you so much for all your help. You got this. Go out in the world and enjoy your life and be the best version of yourself. I'll see you again on Friday. You have a good one.